So what really should we make out of a vaccine trial which has been halted at this stage? Dr. Shahid Jamil, one of the country's top virologists, joins me to get sense of this vaccine race. Dr. Jamil, your sense when these reports come in that the vaccine trials have been temporarily halted because one of the volunteers fell ill, is that routine, or do you believe this is part of the problem when you try to fast forward a vaccine process?
No, Rajdeep, this is something quite normal, and in fact, I am sort of, I shouldn't say either surprised or happy, but I am confident that the trials are being conducted properly. There are systems in place that are dealing with the issue, and that's what data safety and monitoring boards are supposed to be doing. So it's really good that the system is in place to catch this, even if it's happening in one person, because remember, a vaccine has to go out in a population that has people with all sort of comorbidities. So it's really important that the vaccine moves forward after proper investigation and proper safety and proper monitoring. So there's nothing to be concerned about, nothing to be worried about. It's a temporary thing. They'll figure it out and move on.
The reason I'm asking you this is because there's been this huge pressure of timelines. You know, let's get a vaccine out by the end of the year. And that, in a sense, does that put extra pressure, in a sense, on those conducting vaccine trials? Because normally this process is a more elongated one. There seems to be an attempt, both by Oxford and indeed by others in this race, to crunch this process.
Well, the crunch is really accepted globally now. It's based on a global understanding that the trials would be compressed. If the trials were done as trials were done before this, then the COVID vaccine would be available to us in 2033. Do we want that? No, we don't. So, you know, it's always a risk-benefit ratio. We're trying to do trials so that they are done in a safe and efficacious manner, yet things are speeded up. And don't worry about those timelines. Those timelines are very artificial anyway. Just because, you know, someone is going to election in November doesn't mean a vaccine should come before that.
No, but that's precisely the worry. You know, that's precisely the worry. When the US president says, I'm going to get a vaccine in by the 1st of November, you know, that sort of creates expectations, creates a sense of hype. Should we be tempering down the expectations a bit, you think? Should we be sort of allowing this process to go through, rather than sort of seeing this as a sort of daily sort of match? You know, how far have we gone? How many runs have we scored?
Well, politicians will hype things, and politicians all around the world hype things. So there's nothing new. But what is really reassuring is that the medical community, the scientific community, has come together and said, we are not worried about that. We are going to do this in a right way. In fact, 9 pharma companies, the big ones, have all come together and put out a statement saying that we will ensure that all the proper procedures are followed. We're not going to be swayed by any of these artificial deadlines. And that's really a very, very good move, and we must appreciate it.
So going ahead, do you see any sort of hurdles specifically from the point of view of achieving the goals that have been set? What are the hurdles as we move ahead, given the fact that previous vaccine processes have taken much longer?
Yes, so I think the biggest challenge is to do the trials in a manner which is safe and the vaccine is eventually proven to be efficacious in these compressed timelines. And I believe people around the world who are running these trials, running them independently of the developer or the manufacturer of the vaccine, are doing a damn good job. There will be challenges, of course there will be challenges. Let me recall what happened in 2011 for the cervical cancer vaccine in India. 7 tribal girls died after being given the vaccine, and that's out of thousands. The trial was immediately stopped, and this was of a vaccine that was proven to be efficacious globally and was being used globally at that time. So these things do happen, and the critical thing is to ensure that there are systems in place to address these issues.
Let me
So
ask you.
I'm quite reassured that what is being done is good,
Right.
and moving forward, things will be fine.
Let me ask you in conclusion, as we see AstraZeneca, the Oxford vaccine partnership with Serum Institute and the trials going ahead in India, you've got Bharat Biotech also doing its own projects, a lot of American companies also involved. Is there a front runner you see, or would that be unfair to position anyone as a front runner?
I don't think we should see it as a race. There is no front runner. There is enough demand that anyone who comes out with an efficacious vaccine will be able to sell their vaccine. And it's also good for the consumer, because the consumer for the first time will have multiple choices to go for. So I think overall it's a good thing.
You've reassured us, Dr. Jamil, on a day when there was an element of panic as to whether the Oxford vaccine had gone horribly wrong. What you've suggested is that this is routine, and in fact, it's a good sign that the strict procedures are being followed. Appreciate your joining us, Dr. Shahid Jamil, one of India's top virologists, on the big vaccine, dare I say, race, as we call it, at least on news television.